My name is Jennifer Lewellyn, and I'm an Oncology Nurse Navigator in Medford, Oregon. Today I'm here to talk to you about the role of nurse navigators and how they may be involved in supporting people affected by head and neck cancer. The position of the nurse navigator is really there to support the patient and their family or caregivers so that they have the smoothest and easiest journey through diagnosis, treatment, and into recovery. An oncology nurse is often seen in the radiation oncology clinic or in the medical oncology clinic. There's also infusion nurses who specialize in administering infusions to people with cancer. So my role as the nurse navigator really looks at the big picture, the overall view for the person, the family, the care team. It is most common for an oncology nurse navigator to get a referral from a member of the multidisciplinary care team. That might be the ENT or the medical oncologist or a radiation oncologist, and oftentimes it is from the oncology nurse. Nurse navigators are most likely found in larger care organizations, institutions. As you go into smaller and smaller cancer centers or clinics, it will probably be more challenging to find a nurse navigator. I would recommend asking the oncology team, could be the doctor or the nurses, if there are any nurse navigators within the clinic, the organization, or in the area. If they're having a difficult time finding them, they could also try checking with the Academy of Oncology Nurse Navigators. It's an organization that a lot of nurse navigators are members of. For people who don't have a nurse navigator readily available where they live or where they're getting treatment, I would recommend that there are resources through SPONC. They have some publications that are very helpful. They can also ask the nurse in the clinic to help. There's different positions in nursing and specialties. In many of the medical oncology clinics, there are triage nurses, and they're there to help. And in some smaller towns, it may be the radiation oncology clinic nurse that's doing some of the navigating for the patient. When a person comes with head and neck cancer to the radiation oncology clinic for their consult, the first people meeting them there are going to be the nurse in the clinic, myself, and the physician. That is when I take the opportunity to explain what my role is and that I am their best point of contact if they're ever confused about who to contact or even what to ask exactly. The first time that I meet with one of our patients in the consult room typically is when I introduce myself. I explain to the person what my role is there for, all the different things that I can help with: education, care coordination, advocacy, reducing barriers, and referring them to resources that will help them get through treatment. I meet with patients weekly during treatment. After treatment, it tapers out a little bit. It might be every 2 weeks or once a month. I contact them by phone fairly frequently prior to even starting treatment because there are things that need to be coordinated and need to happen before they can start treatment. We need to make sure that their imaging appointment for diagnostic reasons is completed. We need to make sure that they've had a dental evaluation if they're going to have radiation to this area. Some patients haven't had a dental evaluation for perhaps years. So then I'm assisting them with finding a dentist and doing all the steps necessary prior to starting radiation. So at times I'm working with patients and contacting them very often prior to even starting the treatment. I almost contact them daily if we're at that point where things are urgent and we need to keep things moving along. Remember, if you or someone you love is affected by head and neck cancer, you are not alone. Together, we are made of more.